Welcome to your overview lecture on renal and bladder tumors. Please be sure that you read your corresponding chapters in your textbook and review any of your learning resources accessible through your course module. So let's talk a little bit about renal tumors. So they can be primary or from a malignant process. The symptoms that your patient is going to experience are going to be different based on the size of the tumor and the etiology of the tumor. The clinical presentation of these patients, they may see gross hematuria. You may see hematuria on a urinalysis, and we'll talk about that in a second. They may feel a dull, achy abdominal or flank pain, likely going to be tired. They may have intermittent fevers, and they may experience weight loss. Objectively, these patients may be demonstrating elevated blood pressure from the processes going on at the level of the kidney. There may be appreciable adenopathy when you palpate. They may have lower extremity edema. You may be able to appreciate an abdominal mass on palpation. Renal tumor patterns from metastasis, likely to the lung if it's going to metastasize. So you want to make sure to do a comprehensive respiratory system evaluation. Might be one of the times that you would percuss liver margins, looking for any changes in the size of the liver, also suspecting potential metastatic processes. Your differential diagnoses would be renal cysts, renal calculi, renal infarction, renal TB, polycystic kidney disease, or hydronephrosis. Diagnostic tests that you may engage with, certainly you're going to do a urinalysis, a dip stick when the patient's in the office, send off for a complete urinalysis is a good idea. Here you're not going to want to do a basic metabolic panel. You're going to want to do a comprehensive or a chemistry profile, which has about 24 elements on it, I believe. You want to get a CBC. So in your office, your urine dip likely may show hematuria or proteinuria. Your CBC, you may see a decreased hemoglobin or an elevated red blood cell count. On your chemistry profile that you're going to be looking for at your liver functions tests. Elevations may be indicative of a metastatic process. Certainly, one of the key things you're going to focus on your chemistry profile is your creatinine level. Other tests that you may order, ultrasound is a great choice for imaging. It can help with your differential diagnoses from the cyst perspective, the mass, any other metastatic lesions, if they're present in the region. Anything that shows up there that makes you suspicious for an advanced process, then you may follow that up with CT testing or MRI testing. Anything that's determined that needs biopsy is going to be referred out to the specialist. Of course, we're not going to be doing that in primary care. And I would caution ordering any test that would include contrast media because of the pressure that that puts on the kidney, and you already have a process going on in that renal system. You don't want to complicate that with a diagnostic test. What's the management for renal tumors? Well, primarily it's surgery because chemo has been not demonstrated to be effective. At that stage, you're not going to be the person managing this, but you can follow the patient up for any non-cancer related healthcare issues. But I want to caution you in this. The human body is comprised of 10 systems that all work in tandem together. So when you're evaluating the patient for a problem, and we did say that one of the primary site for metastatic from the kidney renal processes to the lungs, if you're evaluating the patient with primary respiratory complaints, keep in mind that metastatic pattern and make sure that you're not falling victim to thinking that this is a minor respiratory process when this is the first signs potentially of a metastatic problem. So when the specialist and the surgical intervention take place, it could be partial or total nephrectomy, maybe followed up with immunotherapy or radiation therapy. The specialists are going to be following up with your patient post-intervention every 3 to 6 months, renal ultrasounds periodically, 6-month frequency for 3 years, and then annually. Chest x-rays every 3 months for the first year because of the pattern of metastases to the respiratory system. This patient's likely going to be under the care of a urologist or a nephrologist, and potentially oncology specialists as well. So now let's talk a little bit about bladder tumors. So bladder tumors, the presenting symptoms are going to be based on the number of tumors and how involved that process has become for your patient. So they may notice hematuria. They may be experiencing pelvic pain. They may be running a low-grade fever, chills. They may have some weight loss. Because the tumors are in the bladder, they may have symptoms similar to a cystitis. So dysuria, frequency, urgency. With these patients, you want to get information in your subjective data collection about their smoking history. Objectively, the patient may have CVA tenderness. You want to make sure you do a good respiratory system assessment, palpating for lymph nodes, palpating abdominally for any other masses or percussing liver margins. Differential diagnoses here include renal cysts, renal calculi, renal infarction, renal tuberculosis, polycystic kidney disease, and hydronephrosis. In your diagnostic studies, certainly you're going to be doing a urinalysis, a complete urinalysis, maybe a urine dip in your office, likely going to be positive for hematuria. You may send the urine specimen off for cytology, which would show atypical or malignant cells. Renal and bladder ultrasound, you're looking for a tumor. You may be looking for an obstructive process at the level of the ureter or above. Imaging may come in the form of CT or MRI when you're wanting to evaluate the ureteral system. And again, caution you for using contrast media in these patients who have processes going on in their renal bladder system. Please be sure that you review the information for tumor staging on table 45.2 on page 667 in your textbook. Oh, let's talk about something else for your diagnostic testing. It's not represented on your slide, but you're going to want to make sure that you get a chemistry profile and think about what we said for renal tumors. You're going to want to evaluate liver functions tests because elevations in liver function testing may give you an indication of a potential metastatic process. Management of bladder tumors is going to be based on the stage. Here are the stages: 0 to 1, 2 to 3, 4, and 5. Management of patients with bladder tumors is not likely going to be in the primary care setting. You will be following up the patient for any non-cancer related issues. And remember what we said previously, this human body is comprised of 10 systems that work in tandem to each other. So if you're evaluating one system, please consider the impact that the bladder tumor process may be having on that system. These patients are going to be managed by urology, surgical oncologists. They may end up with an ostomy, and so they may have intervention from an ostomy nurse. For superficial tumors, follow-up by their specialist is going to be about every 6 months or more frequently as determined by the specialist. Here are your references for the information provided in this lecture, and please be sure that you review all of your chapters relative to this topic and your learning resources in your course module. Thank you.